Welcome to the University Health Services Health Promotion Program's Party presentation, a presentation on alcohol and other drugs in the college community. We're going to play a little trivia game, and we'd like you to follow along with the question and answers that we have provided. The first question is, how do the following characteristics determine the effects of alcohol on your body? For example, gender, mood, body weight, the type of alcohol that you consume, whether you have a full or an empty stomach, the speed at which you drink your drinks, and also the use of medication or other drugs as they might interact with the alcohol that you're consuming. I think it's important to remember that there's differences in how you metabolize alcohol based on gender. Women tend to feel the effects of alcohol more quickly than men. Alcohol, in terms of your mood, is a depressant, so if someone is feeling sad, it can exaggerate this feeling. People who weigh less are going to be more affected by alcohol, and so that's an important thing to remember when you're drinking your drinks. A full or empty stomach also impacts how you process the alcohol, so it's really important to try to eat at the same time that you're drinking in order to slow the consumption and also slow the process of the alcohol impacting your system. The speed of consumption, or how quickly you drink your drinks, is also an important indicator of how alcohol is going to infect you. Drinking a beer over an hour would be much different than drinking a shot within 10 seconds. And finally, it's really important not to mix alcohol with other medications or drugs, even over-the-counter medications like allergy medications or cold medications, because they can have an even greater effect on the body in terms of the impact of alcohol. And just a quick factoid, a person with an average weight and body type would metabolize approximately 1 drink per hour. Okay, here's another quiz question for you. What is the intoxicating substance in alcohol? Is it propanol, methanol, ethanol, or isopropanol? Okay, the answer is ethanol. Ethanol is what makes you feel the effects of the drink that you're drinking. And here's another little party factoid for you. 1 drink is approximately 12 ounces of beer, like a bottle of beer, 5 ounces of wine, and then it's also important to remember that sometimes when you're out at a party or out drinking, they may serve you more than 1 drink at a time. So for example, a 20-ounce mug of beer is actually 1.5 drinks, and a Long Island iced tea, which may have a few different shots of alcohol in it, could be as much as 2 to 3 or even more drinks in 1 glass. Okay, let's try this quiz question. Who drinks more overall, college students or non-college students? The answer would be college students. The types of consumption, according to ACHA, the American College Health Association, college students fall into perhaps 4 different categories. There are students who don't drink at all. Then there would be students who are current users of alcohol, which would be someone who's had at least 1 drink in the past 30 days. Then you have students who are binge users or high-risk drinkers, which would include students who've had 5 or more drinks in one sitting at least once in the past 30 days. And then the 4th category would be those high-use drinkers, college students who've had 5 or more drinks at one time at least 5 times in the past 30 days. So here's one more question for you. Where do the majority of college students fall? Are they abstainers, current users, binge users, or heavy users? Okay, they would actually fall in either the no user abstainer group or the current use group as the most common category for college students.
Here's a question. What % of college students drink alcohol every day? The answer is the perceived rate of students' daily use is 36%, but the actual rate of alcohol use is 0.5%. So in actuality, only less than 1% of students use alcohol daily. And this question kind of highlights the social norms theory, which predicts that most students make healthy and safe choices. Here are a couple more party factoids related to the social norms theory. 25% of college students have not consumed any alcohol during the last month. 50% of college students nationwide consume 0 to 5 drinks during a 2-week period. 70% have not driven when intoxicated. Question: what is the relationship between alcohol and grades? Answer: on average, students who drink the most alcohol receive the lowest grades. So rates of alcohol use are inversely related to GPA, and students who drink more tend to receive lower grades. The breakdown is as follows. D and F students on average drink 9.5 drinks per week. C students on average drink 5.6 drinks per week. B students on average drink 4.4 drinks per week. And A students on average drink 3.1 drinks per week. And here's another party factoid. According to the CORE survey, 159,000 of today's first-year college students will drop out of school next year for alcohol or drug-related problems. Here are a few tips on how to party safely. Mixing alcohol and other drugs can have dangerous effects, so you should not mix alcohol and other drugs because of the interaction. You should try and protect yourself from date rape drugs by watching your drink. Date rape drugs can be tasteless, odorless, and undetectable in alcoholic and non-alcoholic drinks. Keep track of how much you drink by drinking from cans or bottles. And be sure to party with a buddy and always have a designated driver.
How to help a friend who's had too much to drink. Here are some signs and symptoms of alcohol poisoning that everyone should be aware of. If you or someone you care about seems confused or disoriented, maybe their breathing is irregular, very shallow, or too slow. If their skin color is off in color, like they seem very, very pale or bluish in color, maybe even very, very flushed, or if their skin is cold or clammy, this may be a sign of alcohol poisoning, and you need to get help right away. In addition, if someone is vomiting as a result of alcohol consumption or even having seizures, you definitely want to get emergency help as soon as possible because this condition could be life-threatening. So what you want to do is get help by either calling 911 if you're off campus, or you can also call campus security if you happen to be on campus at 956-6911. Either way, you need to get help as soon as possible. While you're waiting for someone to come, you want to make sure you stay with that person and keep them lying down. You don't want them to be wandering around so they could possibly fall. And also, you want to have them lying down on their side to prevent any kind of choking if they were to vomit. Places on campus that you can get help in terms of more information and education about alcohol use behaviors, or if you or someone you care about needs help in terms of addressing perhaps their problem alcohol use behavior, a great place to go is to the Alcohol and Drug Education Program. ADEPT is located in the Queen Liliuokalani Center for Student Services building, and it's in room 313D, so on the third floor of Student Services. And also, one really important thing to remember is that only time will help someone metabolize the alcohol. So, for example, giving someone coffee, giving someone food, giving them water is not going to make them less drunk or relieve the symptoms of alcohol poisoning. Really, it has to be time or intervention by a health professional. And also, you should be aware that blood alcohol level can even continue to rise after someone has passed out. So that idea of just putting someone to bed, perhaps so they don't get in trouble, or letting them just sleep it off could actually be life-threatening. So stay safe, take care of each other, limit your use of alcohol, and always party with friends. Don't drink and drive. Some of the key points that come from this presentation. For more information, you can always contact either the Alcohol and Drug Education Program, or you can contact the Health Education, Health Promotion LOCAHI program, also located in Queen Liliuokalani Center for Student Services, room 313D. What we want to have you do now is you're going to see a video clip that focuses on alcohol use behavior on college campuses. We think you'll find it very interesting. After you've seen that video clip, don't forget, just like you did for our other presentation, to make sure you fill out the evaluation forms. Thanks so much, take care, and we'll see you soon.